Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. And joining us this morning, we have Dr. Jason Field. We appreciate you being here, talking about something really important, which is endometrial cancer. To get us started, if you could explain what it is.
So endometrial cancer is an overgrowth of the lining of the uterus where the cells basically stay around too long and become a cancer with uncontrolled growth.
Now, when you look at, are there age groups, people most at risk?
Yeah, it's most common in people in perimenopausal age, around mid-50s, but is happening earlier and earlier, like many cancers are.
Well, see if it's the concerns. What are some factors maybe that put women at greater risk?
So the metabolic syndromes like diabetes that's associated with high blood pressure and obesity, hormonal imbalances like polycystic ovarian syndrome, about 10% of the time it can be genetic or familial. So multiple factors.
In some of those cases, if it is in the family, are you more likely to do testing, or how does that work?
Well, thankfully, most endometrial cancers present early with bleeding. So anybody who's having heavy or irregular bleeding, especially if they're postmenopausal or perimenopausal, which is tough because often people have irregular bleeding around that time, they should see their doctor and they would get checked for that. The diagnosis is made with a biopsy that can be done in the office very easily and safely. Oftentimes people get an ultrasound also in the office.
And how is the cancer treated? Where do you go from there?
Most of the time it's treated with surgery, with a hysterectomy. Nowadays that's usually done laparoscopically or robotically. It's actually much better than it used to be. Most patients go home from the hospital the same day. Some patients have virtually no pain. About 30% of patients with endometrial cancer will require some additional treatment, but most won't, just the surgery.
Is it hard because sometimes, as you mentioned, bleeding can be, it's not on a calendar at that point. No, any abnormal bleeding should get checked out. I think it's important to see a primary care doctor or a gynecologist once a year. In addition to all those things we do for ourselves every day, like trying to eat healthy and exercising, all those can go along to prevent endometrial cancer. So if you go in for your annual exam especially, that's when you need to really make sure you're talking to your gynecologist.
Yeah, it seems like we probably don't do a good enough job educating patients and even other doctors at how critical it is to evaluate bleeding that happens to women around that age. So people should know that abnormal bleeding, when you're not normally doing that, should get checked out by a doctor.
So make sure if you talk to your regular physician, also your OBGYN.
Exactly, yeah.
And you also said it's important we talk about HPV vaccines.
Yeah, that's been one of the biggest improvements in our area of medicine, is having a vaccine that actually prevents cancer. Very unique. Cervical cancer is caused by a virus, human papillomavirus. Vaccinating kids, ideally before age 15, so age 9 to 15, with sometimes just one dose of a vaccine can prevent abnormal pap smears and cervical cancer for their whole lives. And
that's something that they should get whether they're sexually active or not.
Yep, any boys or any girls. 80% of people have human papillomavirus, have been exposed to the virus, so it's important that everybody gets vaccinated.
And anything else you want parents and families to know?
I think the most important thing that we do is what we do every day for ourselves, trying to get some activity or movement every day, 15, 20 minutes of exercise, trying to eat foods that you ideally prepare yourself and that are healthy.
We think about those things for weight loss, nutrition, but it plays a role in these as well. All right.
Sure does.
Well, thank you so much for being here. By the way, if you want any additional information on today's topic, just go to hot links right at the top of WNEM.com. We're back in just a moment.